People try to shift back into the most normal version of their lives in 2 years. COVID continues to shift too.
It does. So here to answer your questions is Dr. Shira Doron, the hospital epidemiologist at Tufts Medical Center. Dr. Doron, as always, it's great to see you. Thanks for your time.
Good to see you.
Yes, Dr. Doron, thanks for being here. So first it was Omicron, of course, then the BA.2 subvariant. Now we have a spinoff of that. 2 new Omicron subvariants causing a spike in cases in South Africa. Is there any escape to this cycle as the virus just continues to adapt?
I think that what we're seeing now with periods of low cases followed by periods of higher cases, ups and downs, that's our new normal. I still hear people talk about what they'll do when COVID is over, but I don't think we can bank on it ever getting any better than this. And we could see big spikes again too in the future. It all just depends on how the virus mutates. So that's why I tell people if they're vaccinated and boosted, they should assess their personal risk tolerance and do the things that are most important.
So Dr. Doron, let's take it from that point on. So far, many of these new versions, there are new versions. They've been more contagious, but not necessarily more deadly. So is that what you'd expect to see in this COVID evolution?
No, I wish that were true, but unfortunately, that's a misconception. You see, mutations are random. They can make new variants more deadly, less deadly, or the same. And if the new variant has a growth advantage, like it's inherently more contagious or it spreads better because it evades immunity, then it will outcompete other variants. But being less deadly doesn't provide this virus with a growth advantage because this virus puts you out of commission or kills you in week 2 or 3 or 4 when you're no longer contagious and you've already spread it to everyone you're going to spread it to. So for that reason, it can't be expected to be evolving to be less deadly, but we did get lucky that Omicron was less deadly.
All right, well, back to the contagiousness of these variants. Obviously, being more contagious means more people will likely become infected, even if they don't know it, which is often the case, of course, with COVID. So how does that impact the overall immunity and our defenses against another surge?
Well, both vaccination and infection protect against future episodes of severe disease imperfectly, and that immunity wanes somewhat over time. Now, there was an NIH study from before the Omicron wave that showed that over 90% of people had antibodies already from either infection or vaccination, and yet we still saw a massive surge due to Omicron. So anything is possible. But I believe that as people get repeatedly vaccinated and repeatedly infected, we will build an immunity wall that will make subsequent waves less and less deadly. But in the meantime, we have very effective therapies that we need to make sure everyone has access to.
Dr. Doron, thank you so much for your expertise and your time. Great to see you.